to you by Seattle Sutton's Healthy Eating.
Hello again. I'm Linda Marshall. My guest, Dr. Anthony Geroulis. He is a plastic surgeon. He is medical director of North Shore Center for Cosmetic Surgery. He is also clinical professor of surgery in the Department of Surgery at the University of Chicago. We're delighted to have you with us today, Doctor, and certainly your field is one that is experiencing an explosion, isn't it?
It is. It is. It's quite busy. Quite busy.
Did you anticipate just how popular cosmetic surgery would be when you got into this field?
Well, I've been doing cosmetic surgery for 24 years. When I first began doing it, it was really an operation that was done more on the elite. People with a great deal of money, or people in show business.
The rich and the famous.
The rich and the famous, correct. Through the years, it has come out of the closet, if you will. And now it's a very, very common operative procedure in terms of the general use of the word cosmetic surgery for people to do of all walks of life.
It is much more accepted today, but there's another side to that, and now we're hearing about and reading articles about teenagers who are having cosmetic surgery, not because they really need it, because of some kind of injury or birth defect or whatever, but simply for the ability to compete, I guess, with other teenagers today. Does that bother you at all?
Well, that bothers me a great deal. As a professor of surgery at the University of Chicago and in my own private practice, I very much am upset by the fact that children, teenagers, are exposing themselves to body changes which oftentimes are premature, may not even be needed at all, and in fact shouldn't possibly be done at that age.
They're not fully developed.
Not at all. The problem is that there's new forces in the market that are so competitive, and they are out there advertising, and they oftentimes people say things but don't have the credentials to back it up. As a result of this, the public needs to be more careful on choosing their doctor and to make sure that doctor is qualified. And that's where I think teenagers sometimes on an impulse get misled and get into surgery they shouldn't get into.
As a clinical professor of surgery at the University of Chicago Department of Surgery, you're actually teaching other cosmetic surgeons how to do the work.
Well, in fact, I not only teach the resident staff at the University of Chicago, but I hold seminars for doctors. I just finished a recent seminar that we held up in Northfield for the doctors that flew in from Puerto Rico, Canada, really all over the world. We have seminars there where I teach them both in lectures and they watch the surgery themselves. None of the students ever do any of the surgery that I perform, but they do watch. And so they are allowed to watch the techniques, and through repetitive watching of the techniques, hopefully we can get them trained.
This seminar, it's one of a series of seminars that you give throughout the year. How does that work?
Yes, I gave this one recently at the North Shore Center for Cosmetic Surgery in Northfield, where I'm based. And then I also give seminars at the University of Chicago. We'll be giving another one in March. I'll be heading that one up at the university, and that one will be on facelifts. This last one was on eyelid surgery and forehead surgery.
As a cosmetic surgeon, do you cover the entire gamut? I mean, can you do cosmetic surgery on any part of the body, or do you have just a certain specialty?
Well, I'm able to do cosmetic surgery on any part of the body because my training is quite broad. However, I have restricted myself, sort of sub-specialized, if you will, to facial surgery and body liposuction surgery and body scars.
Liposuction. Now there is an area of great discussion and debate, right?
Yes.
Well, give us your view on liposuction.
Well, liposuction is a fabulous procedure, and it is very safe if done in the correct hands. Mm-hmm. You hear the horror stories of liposuction, and when they occur, they are horrible. Mm-hmm. They are truly disastrous. But the good that liposuction does is wonderful, and hundreds of thousands of procedures are performed a year. What liposuction does is it takes away the bulges in areas that it's very difficult to work off or diet off. Mm-hmm. Those areas,
the spare
tire on men, or the love handles on men, the tummy on ladies, and men, the thighs, the saddlebags, if you will, on women, and interestingly enough on men, the breasts. Because men, oftentimes as they get older, their breasts get a little bit larger. And liposuction can take that largeness down to a normal size, and the skin will shrink in pretty beautifully. And as a result, it's quite an amazing procedure.
Can you give us an example of like the horror stories, why it shouldn't be done on certain people or when, in certain situations?
Well, there again you have a question of, number one, you need to check the training of your doctor. Make sure that doctor is really adequately trained to perform liposuction. You have to find a physician who is able to handle emergencies and who has surgical experience, because you are having an operation.
And elective, quite often.
That is right. It's all elective.
You're taking
and as a result, you are walking in as a well person, and you would like an improvement, whether it is a smaller tummy, less saddlebags, get rid of wrinkles on your face, so forth and so on. So you need to know, number one, who you're going to, what their years of experience are, and their training. The horror stories are oftentimes too much was removed.
Okay.
When you have too much of a fluid body shift in a human being, you run serious risks for their health. It has to do with their heart flow and so forth. And the areas that have been noted most often in the press are areas where too much volume may in fact have been removed. Also, it can cause bleeding. And in those cases, the doctor needs to be prepared to know what to do.
Now, I know one of your specialties is what is called invisible lower eyelid cosmetic surgery.
Right.
Which, of course, you perform at the North Shore Center for Cosmetic Surgery. By the way, you have two offices, two centers?
Well, I have an office up in Northfield at the North Shore Center for Cosmetic Surgery. We also have an office downtown on Walton Street, and then we have an office also at the University of Chicago, where I also head up the teaching for cosmetic surgery in the section of OH&S.
You're a busy man.
I travel the city, right?
We actually have some pictures in a brochure Dr. Geroulis brought along that give you a hint of the before and after. There you go. The top one is before, and then underneath that is after. And Doctor, if you just want to tell us what happened there.
Surely. This young lady came in, and she was very tired of having a tired look. Many people kept saying she looked like her mother, and she was in fact looking a bit like her mom. And so she underwent a forehead lift, a forehead brow lift, with incisions that are very hidden in the hair, and we can discuss that procedure if you like. She also underwent eyelid surgery to remove the excess skin on her upper eye, and she also had the fat puffiness underneath her eyes, the bags, if you will, under the eyes, removed from the inside. And then she had a face neck lift. And so that got her to looking much more youthful, much more fresh.
Now, I'm going to move over to this other side because this is eyelid surgery, right?
Right.
And the top picture, what did you do here?
This gentleman had his upper eyelids his brow lifted a bit, and his lower eyelid bags removed.
Okay. Was this done with the invisible
Yes, it
surgery?
was.
And I'm going to have you describe that. And here, this woman also had a procedure.
This young lady only had the bags of her lower eyes operated on. You cannot see it as well on this television projection, but she had big puffiness under each of her lower eyes. And this was removed by me by using a technique where you place an incision on the inside of the eyelid, of the lower eyelid. And you go in carefully and remove the fat in the exact areas that it needs to be removed. You don't remove too much.
Mm-hmm.
And so you give the patient a nice, smooth, natural look.
Mm-hmm. There's also, there are a lot of pictures in here. I was going to show one. There are, of course, my recollection of plastic surgery, when I first started hearing about it, was someone had their nose altered, okay? And here you see at the top here a woman who had nasal surgery. And often it's done in conjunction with a necessity, right? Some type of necessary procedure because they can't breathe properly.
Yes. This is a procedure, one of the few procedures that one could entertain in teenagers.
Right, and frequently done.
Okay. As a result, because they have a large nose, and oftentimes it's causing them problems in breathing.
Right.
It also can cause problems with snoring. It also is sometimes precipitated in men, or young men, from sports injuries, basketball or football. Not long ago I took care of a young man who suffered a baseball injury, and a bat came flying across and his nose became bent.
Doctor, if it's elective, in your counseling procedures, do you often turn people away from it? Do you guide them, in another direction, saying, this really isn't necessary, or is it the kind of thing now where it really is a matter of choice?
Well, to answer that, I have to tell you that a number of years ago, I would turn a number of patients away because the public was not really educated enough to know whether or not they needed something done.
Mm-hmm.
And so oftentimes a man or a woman would come in and say, I need a facelift. And I would have to spend 30 minutes to an hour explaining to them that they did not need a facelift. They may need one in 10 or 15 years, but they surely do not need one today. And it would be a waste of their money, and it shouldn't be done at this time because it's just not going to give benefit.
Mm-hmm.
That number has decreased. I still tell a number of patients each week that they don't need surgery, but not nearly as frequently as I used to. And the reason for that is that the patients have become very much aware, thanks to the media and thanks to other people coming out of the closet in the last 15 years and discussing more openly cosmetic surgery. As I told you, this is not done any longer on the rich and the famous.
It's done
on everyone.
The public, right, in general. One of the concerns I think is pretty well known is that you get a facelift, but it doesn't last that long. But you're renowned for being able to perform these operations in a way that are reinforced to hold that rejuvenating effect. What is the process? How do you do that? What's the difference?
The difference, well, that's part of what I teach at the courses and that the University of Chicago has me heading up. Some of it has to do with the techniques that I apply in terms of, in a facelift, for instance, you don't just lift the skin. You lift the musculature underneath the skin.
Mm-hmm. Mm-hmm.
And as a result, all of this is put back. Therefore, when you lay the skin back, you don't have to pull it tight. You see, that tight look in facelifts is not very pleasing, to me anyway. No. It gives a very fake look, that wind-blowing look. And that is caused most often by pulling too tight and as a result not having a natural look. Mm-hmm. If you support that from the inside and you pull the muscles up under the skin, then you can lay the covering down, and then you'll have a nice natural look.
What are some of the latest techniques, some of the new breakthroughs that you're able to offer your patients?
Well, we'll start from the top and work down. How's that? In the forehead area, for all of the wrinkles across the forehead, we used to have nothing to do except surgical procedures.
You can maybe
now,
share
today,
that with our audience.
Surely. Today what we can do is we can inject Botox in patients who may just have severe wrinkles in this area. And as a result, we can get rid of those wrinkles very nicely, and they will be fine without any big surgeries. The other procedures we used to perform is a big operation from ear to ear, and as a result of that, we would pull everything up and get these eyebrows lifted up and get rid of all the wrinkles. That, however, left the patient with a great deal of loss of hair and numbness. The new procedure that I'm teaching actively for the last 6 years to doctors is where they can take tiny incisions in the scalp and using a device called an endoscope, which is a long tube with a little camera on the end, and you insert that in, and then you lift everything up, you reposition the eyebrows, you don't have to cut away any skin, you don't have to have all this big operative procedure, and you can get a beautiful result, and it holds lovely. So that's the one procedure in that top part.
We have just a minute left. The transconjunctival approach is for the lower
eyes.
Surgery without
right.
Hidden
right. That's
visible.
What that is see, the old method of doing eyelids was to make an incision under the eye and to the side. Now that would not only leave a scar, but oftentimes it would leave the eye a little changed or deformed, a little rounded, or it might pull the eye open and give that operated look.
Mm-hmm. I think the other thing we want to point out, since we're just about out of time, Doctor, is that you do hold these free seminars periodically around the city. Is
yes.
that correct? For the public?
Yes, they're open to the public.
Mm-hmm.
And we've been doing those now for some time. We hold them at the University of Chicago. We hold them downtown in downtown Chicago. We have one tonight at the Westin in Chicago. Mm-hmm. And we have one tomorrow night at the Hyatt in Oak Brook.
Mm-hmm. If you want to find out more, you can contact, of course, Dr. Anthony J. Geroulis, who is, again, the medical director of North Shore Center for
Surgery, clinical professor of surgery in the department at University of Chicago. Sorry it's so quick. Come back.
Sure. Thank you very much.
Thank you. I'm Linda Marshall. News coming up on the Stock Market Observer.
This program was brought to you by Seattle Sutton's Healthy Eating.
Nothing compares to Seattle Sutton's Healthy Eating because we prepare all your meals for the week. Our meals are not frozen or dried, they're fresh. They're for